When we manage to replace this hydrochloric acid in the stomach area in the middle of a meal, whether it be lunch or dinner, we do not use hydrochloric acid in the Maffei system in the morning, because in the morning, the stomach is already acidic, so it starts to get alkaline starting around noon or 12:30, so around the middle of lunch. Therefore, mid-lunch, mid-dinner, you take the drops of HCl with 30 milliliters of mineral water in the middle of the meal so that the digestion can be better and so that proteins can be better digested and absorbed, and that way calcium can enter in the chemical solution, resulting in a decrease of osteoporosis, especially in women. Observe then that the ideal pHs in the saliva, the stomach, the small intestine, the large intestine, the urine, and the blood pH returns to normal with the use of the Maffei system in the hydrochloric acid, or HCl. In this percentage that you can see on the slide, from 3.7 to 30%, we can then increase the absorption of B12, which is one of the most difficult vitamins to absorb from food. Therefore, we decrease the burden of supplements to the patient, increasing digestion by better digesting proteins, calcium, and B2. Note here that HCl has to be with an anti-corrosion cap. So when you ask the pharmacist at the pharmacy to fulfill the prescription, you should be careful and ask him to do an anti-corrosion test on the HCl, because if not, the HCl can dissolve the plastic cap. Therefore, to have a healthy HCl and to create a balance between the ideal pH levels, we need a high degree of purity of 38%. If you have any questions, please contact us and we will assist you. This is the biomolecular iridology. This is a pathology to show you. So, this is a 50-year-old patient. He has type O blood. He can eat red meat, but he has a high consumption of processed meat. He is actually 47 years old, and he shows an iris with a certain genetic fragility because of the spacing of the tortuous fibers between them. We discover from these arrows that appear as if it were an elevation of the stomach area there, in the duodenal area, at 3 centimeters inside the duodenum. There is a tumoral area, and we observe a wart-like elevation where we can compare to this graph from the German system. It shows that it is precisely this area that is already affected by a tumor in the endoscopic area, and also observed in the histological examination of the tumor area, which is a malignant tumor. Note that the use of processed meats, such as salami and sausages, which contain nitrates, nitrites, and saturated fats, can cause your body to absorb the fat in your plasma that is in the direction of the arrow, that indicates the dangers of these processed meats, which can form and contribute to the pathological installation of a malignant tumor. Observe that the darker the coloration, the higher the degree of the oxidation of these fats, and usually it is pork fat ingested, and shows that there is a high deficit of digestive bioenzymes, of which bromelain would be the best thing there is to digest fat. As we are talking about longevity of life, note that in our laboratory we have observed patients who use heated oils. As for the cooking that you do with rice, beans, and pasta, you may not use frying. But from a nutritional standpoint, when you cook each day, the oil that is heated will routinely pass 100 degrees Celsius. The 100 degrees Celsius already shows that there is a degree of oxidation in this fat, and all the fat that goes in will not come out anymore. And it will actually start the formation of clogging atheroma plaques in these arteries and consequently lead to Alzheimer's. Now you see in the couple, both with the wife who is 76 years old and the husband who is 78 years old, we observe a ring in the iridoid periphery that is like a cloud. We notice a yellowish-orange coloration in the 78-year-old man, the husband, that indicates that the degree of oxidation of cholesterol and saturated fatty acids is very pronounced. Regarding longevity, in dark field microscopy, one has to first look at the red blood cells. A healthy person will have clear plasma with less toxins and will notice the ideal pH levels in dark field microscopy. Now notice that in the person who already has a pathology in his longevity, he has a Hurlow effect, an agglutination of the red blood cells leading to a low zeta potential and also a low negative electromagnetic envelope where the contraction agglutinates. The agglutination of these red blood cells will indicate low mitochondrial energy. Also observe now that the intestinal fermentation by low HCl, or hydrochloric acid, is due to the fact that the stomach is one that releases the hydrochloric acid and takes a bolus of food sterilized by the HCl. When it reaches the small intestine, there is less fermentation. So there is less dysbiosis, and there is no lack of control of the intestinal flora with an increase in Candida albicans, which systematically crosses the intestinal wall. It goes through the intestinal pathway and ends up in the bloodstream, where we can see these Candida albicans, these whitest circular forms that you can see in the plasma, which will proliferate and which will cause greater contamination, where it will be parasitized on the red blood cells and can produce formic acid. Therefore, the HCl regulates the ideal pHs and does not provide the environment for proliferation of these candida, both in the intestine and in the ideal pHs, which will be the blood as well. In the bright field analysis, we observe a mucinous adenocarcinoma of the ovary. We can observe that both in the histological analysis, it has an inframural uterine leiomyoma and a subserosal with degenerative alterations. Interesting, isn't it, that in the observation on that specimen, there are sections presented that are completely filled with pasty and greenish material. So there is a tumor pigment that has escaped what is on top of this in the center above this agglutination, showing that there is oncological activity. The breast pigment in the in vitro analysis that was found in a breast cancer patient with a diet that was so high in dairy products. And dairy products, such as cow's milk and its derivatives, have a lot of IGF. And IGF, which is a growth hormone, can grow that tumor area, and it only has a very strong affinity with the breast. So this is a pigment that has escaped from the tumor in which it was observed in bright field in vitro. In longevity of life, the study of genes, and observing genetics and epigenetics, we must have methylation, one of the main mechanisms of epigenetic regulation of genes. Methylation refers to this coupling of the methyl group to the DNA molecule in such a way as to prevent the gene from being read or rather silenced. So we will have there the function of the methylation with an ideal supplementation, which I will show you next. We will now go into acetylation. In acetylation, it determines the speed that an individual can eliminate toxic substances from the body, including caffeine. Slow acetylation can silence and have difficulties and problems to remove certain carcinogens. So we have to have a clean organism with a diet that is organic, seeking green juices, and a supplementation that activates this ventilation and scintillation so that there is a function and a genetic final metabolic efficiency for us. So we're soon going to meet in a moment